Well, hi. I will go ahead and get started. Today we have presenting myself. I'm Veronica Horsley-Pettigrew, Outreach Marketing Supervisor with Care Resources PACE. I've been with Care Resources for 6 years. We have Rashea Nidefski, Community Outreach Rep with Care Resources PACE, and she's been with PACE about 5 years. Then we have Ryan Miller, Associate Director of Marketing and Enrollment as Senior Care Partners in Kalamazoo. I'm not sure, Ryan, how long have you been with Senior Care Partners?
I joined Senior Care Partners in January, so I'm only on about 10 months here now.
Oh, you know everything you need to know in 10 months, I'm
right.
sure.
That first 6 months, yeah.
Exactly. So we're going to go ahead and get started, and I'm going to start with the history of PACE, which is kind of interesting. The PACE model started to be traced back to early 1970s in San Francisco by a group of citizens who saw the pressing need for long-term care services for families whose elders immigrated from Italy, China, and the Philippines. The first center is called Unlock Senior Health Services. This year, they're still in San Francisco. They have celebrated 51 years of service. Unlock is Cantonese for peaceful, happy abode. And it was the whole concept came about with the belief that every individual should be empowered to age at home with dignity and independence. We still believe that today in 2022. And so starting with that whole concept, we continue that concept to this day. And currently, there are about 272 PACE centers in 30 states. And they said here is 55,000 participants. I think that has increased. And there are 14 PACE programs in Michigan. And we have what we call a Michigan PACE Association, where all 14 PACE programs meet monthly, and we collaborate and how best practices and how to get the word out more in all the areas in Michigan. So Ryan's going to talk about just imagine.
Sure, thanks, Veronica. Yeah, just want to kind of paint a few mental images here. So if you're feeling relaxing, so you can close your eyes as I kind of go through this. You can, and I'll tell you when you can open them, or you can follow along with me. But yeah, imagine living alone. Not having that regular social interaction, not eating properly. Maybe you're not bathing. Maybe it's because the shower is downstairs and your bedroom is upstairs and the kitchen's upstairs. So just getting to the shower is more difficult, or stepping over the tall bathtub edge to get in and out is just not feasible right now physically. Imagine not having transportation. Maybe that's you can't get to the doctor's appointment or physical therapy appointment. Maybe it means not being able to visit friends or go to a family event or go to card club like you used to. Imagine just not being able to get the food you need, not having the resources for that. Maybe it's because you have limited income. Maybe that's why you can't get some of the food that you want, or the bathroom remodel project is keeping you from those activities of daily living you're not able to do. Maybe you're missing a doctor's appointment because of health issues or resources or lack thereof, or you're frequently visiting the emergency room or the emergency department. Imagine a scenario where you're just unable to get the prescriptions that you need to keep you healthy, to keep you functioning, or that you just forget to take them. If you had your eyes closed, you can open your eyes now. But imagine any one of those, scenarios can be frustrating. It can be debilitating. But having those, some of those activities just compound where you have more than one of those, that you're experiencing at any one time. How that can just compound, the problem if they are. And now imagine, Chris mentioned at the kind of the beginning of our talk here, having that giant hug wrapped around you. So imagine what that could look like. I think of it, I often give that analogy of the big hug, like Chris said, or just a nice cozy blanket on a cold Michigan fall afternoon, or when you're not feeling well and are sitting down maybe with a cup of soup and you just kind of pull that blanket around you. Imagine if you had that type of feeling within your healthcare system, where you had a primary care provider that knew you by name. They were just one of thousands that you saw maybe on your annual physical. Imagine having a home care team already in place, that you're not having to, Google home care or home health organizations. You've already had that in place. And imagine that you have a rehabilitation team of physical therapists and recreational therapists and occupational therapists there for you, ready to help when you need it. That you have a prescription medication, not only what medication to be taking, but a plan to get that delivered on time when you need it, in the quantities that you need it, in the form that you need it. Have that delivered, to your door for that. And then, a healthcare system that you would have a day center and clinic that you could go to, a day center. All of our PACE organizations have at least one day center in their area that participants can come in for to receive some of the care, and also receive socialization opportunities as well, from whether it's bingo or karaoke. and having that clinic there as well to provide your physical therapy and your occupational right there at the clinic when it isn't appropriate or necessary. Again, to have that, have all of your medical specialists that can be coordinated. And unlike other healthcare models where you're having to kind of do the work to make the phone calls and set up the appointments, what specialist to see and how to get in and how you get to that appointment, to have that medical specialist component wrapped into your care, to have your nutrition services looked out for as well, whether it's making sure that you're getting the meals delivered, if you can't go and get the groceries yourself, that somebody can help with that, having meals delivered, and also getting realistic advice and suggestions on what that nutrition looks like for you, not just a generic recommendation for nutrition and food services. And then having transportation, we find, for all of us, we know what frustration it can be when the car is in the shop for a couple of days of getting to work or getting to appointments. But imagine if your healthcare relied on needing to get to that doctor's appointment or to the hospital or to physical therapy, knowing that you have reliable transportation for your medical appointments. And then the last piece, the kind of that circle of care and that big hug wrapping around you is our social services, from our social worker, spiritual care, mental health and behavioral health, experts that can come and kind of complete that piece of the puzzle for your healthcare services.
Yes, thank you, Ryan. Now you guys are probably thinking, oh, this does sound too good to be true. I can get all these services. If I qualify, I'm going to be able to stay in my home and my family is going to have some support caring for me. The good news is for most people, there are no out-of-pocket expenses for the PACE program. So PACE is a unique entity. You can have Medicare, Medicaid, which would mean you are dual eligible, and there would be zero or limited out-of-pocket expenses for PACE. You can Medicaid only, and there would be zero or limited out-of-pocket expenses for Medicare only. So if someone is Medicare, then they would be considered private pay, and private pay for PACE varies per county you live in. Now, the great thing with private pay for PACE is we're one of the few programs where you're going to get a whole program and be able to pay privately for it. You get the same great care. You would write a check out to the PACE program each month and all the care would be provided. So that beautiful wheel that Ryan was talking about and wrapping that hug around you with all the support and services is available to anyone who enrolls in the PACE program. With PACE, we have a higher income limit than if you were living in the community without a long-term care program. So for 2022, the income limit is $2,523 a month. It is only for the person who is applying for the program. So if you're a married couple, it's the spouse's income who's applying to be the PACE participant that we would go on. Assets for a single person, you do have to have under $2,000. And if you are married, there's a spousal protection that may apply. And this is where carrier law can help with if an asset protection needs to come into play. They can help work through all that with you. And they work with the PACE programs for a smooth transition if someone qualifies. So that some people do start out private pay for PACE and then later become Medicaid eligible. And some people become Medicaid eligible while they're going through the process. So we work very well with carrier law and we can work with them through that. With these programs are a little bit different from other programs in that we can only enroll at the beginning of a month. So if we get a call today and someone has Medicaid and they're ready to schedule assessments, chances are with Care Resources PACE that you would be enrolling on the 1st of the month, which would be November. We close enrollment on the 24th of every month. So that's why we have to have everything processed prior and submitted into the state. And we also work closely with other partners. Like if you already had a private pay agency in that was providing some care, if you were in another program, if you're working with carrier law to kind of finalize the Medicaid process, we would be in close contact to make sure there's a smooth transition over. And the great thing about PACE is even though we all have different names, so there's Care Resources PACE, Senior Care Partners PACE, where Ryan is from, we all provide the same great services. And there are several PACE programs throughout Michigan, and we're trying to close that gap. And hopefully in time, we will have a PACE program, in every county in Michigan. That may take some time, but that is our goal as a PACE organization. And for those who enroll with us, we can become their families. We get a lot of caregivers who are expressing some burnout. They want to keep their loved ones at home, but it can be challenging at times just because a lot of people are still working. They're maybe caring for children, grandchildren. So really designed to be an extra support to wrap that big hug and blanket around someone to keep them in their home. We do have a nice little PACE under our 877 number now. So if you're interested in being assessed for PACE and maybe you're from another part of the state, Care Resources, is out of Grand Rapids, out of Kalamazoo, and it's a hotline, and they will get you in touch with the PACE program in your area. Process. I'm gonna open it up for any questions you may have. Please bear with me. I seem, my computer seems to be frozen a little bit here. I apologize. I seem to be frozen. You still on? Oh, there you are.
Yes, I'm here.
Okay, I see your picture now. My apologies. It's in chat. So you can put questions in the chat. Is that how you have it set up, Chris?
Or they can put them in
Or in the
the,
Q&A?
are you ready for the questions?
Yes.
Yes. Okay.
Can you go a little into what it looks like for a day with a participant coming to the day center? What does that look like for them in the family?
Well, that can vary. It depends on the person in the program. When you are admitted into the program, all of the disciplines weigh in and they evaluate the person. And so they put together a care plan. And each care plan is unique to each individual's needs. So coming to the day center, they may come 5 days a week, they may come 1 day a week, and some people sometimes choose not to come. But if you choose to come, normal days, you are picked up by a driver who will cover your area, and they will get to know you because that would be the same driver you would have every time you would be transported to the center. You would come in to the center and would be met by the receptionist, and then they would make sure to get you checked in. And then you would go to the day center, and typically there's 2 snacks and a lunch in the day center activities. And so I think, I'm not sure what they were doing today, yesterday, or playing bingo, and sometimes there are exercises. There are key parties here that we have here at the center. You might go to physical therapy. We have our own gym here. So that is on, we try to do a lot of things to service the person when they come in. So you might go to the clinic, because we have our own clinic building with the nurses and the doctors. So if there's any medical needs that need to be met, or to see an eye doctor or a dentist, audiology or something like that, then you would take care of those appointments while you are here. And if you need physical therapy, occupational therapy, that will be taken care of as well in the gym. So that's kind of it depends on what the activities are. We have a calendar for the whole month of activities for that month. So you would know prior to coming in what to kind of expect that day as far as activities are concerned.
And you provide meals as well?
Yes, 2 snacks and a lunch. Oh my goodness, and the lunches and the staff members, we sometimes bring our lunch, and so we also eat the lunch because the lunch is very, very good. So yes, and so the service, each we have a home health aide in the day center. So we have 3 rooms. We have a very large day center, and we have 2 smaller day rooms for individuals who maybe the large room is a little bit too overstimulating. It gets pretty loud and exciting in the large day center, and people laugh a lot, and they're sitting with their friends talking. Very social, and then when it's nice outside, you can sit outside, and we have 3 outdoor porch where you can sit and listen to the water features, or just talk and sit on the pergola. So those kind of things. It's very homey atmosphere, I think, and they play cards and just a lot of socialization.
And what? Go ahead, Brian.
I was going to say, yeah, if I could, and one of some of the additional kind of beauty or benefit, of the day center aspect, for it is kind of dual fold. In many cases, it's not only for that participant and some socialization, physical, health needs that get to be met, but in many cases, it's for it's also a benefit for the caregiver, as well. That needs, that is kind of providing some of that care, sometimes 24/7, just to have a half a day once a week, or half a day twice a week, whether they're working, or to have some time for themselves, or to get a project done around the house. So it provides that a huge benefit for the caregiver or the family, just to have somebody, a place for that loved one to go for part of the day, know that they're well cared for, and getting activity while the caregiver can have access to themselves as well for other tasks.
And do you also do bathing at the day center? If, let's just say, if a wife is there and the husband doesn't want to do the bathing, can that happen at the day center?
Oh, absolutely. If it's not done in the home, and we also shower in the home, but sometimes people, before they start socializing, they come in for the showers. And we are known here at Care Resource for our showers. One of our aides won an award from Michigan because she does like a spa experience, one of the participants said. Because, when you're being showered, it can be a little bit invasive. Sometimes it might sound always not, sounds kind of glamorous, but I think it's how the person gives a shower. where you can still keep your dignity and feel really comfortable. And she kind of went above and beyond with that, and using certain shampoos and massaging and things like that to really make it more like a spa experience and make people feel really, really comfortable. But I think that's really, really awesome that we have so many, our rooms are large enough for a shower, for a Hoyer lift if someone needs to be lifted, and for a wheelchair, walker, and for more than one A to B and with the, and given the shower. So yes.
Right. And we have a couple questions in the Q&A. I know it looks like Ryan is answering one, but there's a question on if Muskegon County has a PACE program. And there is Life Circles PACE that covers most of Muskegon County and also covers parts of Ottawa County. And then there's one that just came in. How do you qualify? Do you have to be homebound? If a couple qualify? That's a great question. So for the PACE program, you have to be 55 years and older and meet nursing home level of care, but want and be able to stay in your home with support. So we often get the question of how can I meet nursing home level of care, but be safe to be in my own home? And that's what the PACE program is designed to do by wrapping that wheel of care around the person and their family, providing supports with the day center, with certified and uncertified caregivers coming in the home, meals, the medical clinic, transportation, prescription drug coverage to make sure everyone's getting their medications. Because I'm sure Ryan has probably heard about this or ran into this himself too, but I know Veronica and I were going out and doing assessments for some time, and we unfortunately would hear a lot of people say that they're rationing their insulin because they cannot afford their insulin co-pays and food for themselves and their utility bills. So the great thing with PACE is when you're enrolled, we meet your needs. We're responsible for the person enrolled. And so we will cover prescription drug costs. There's no donut holes, there's no co-pays when someone enrolls. So someone that has insulin, for example, that's covered in full by the PACE program. And so how we are designed to be alternative to nursing home placement. Not that nursing homes are bad, but most people want to stay in their own home, and that's their goal, and families want them to be at home too. And so that's kind of why PACE was designed, to help people stay home, but provide the supports that are needed to do so.
Well, and I think that nursing home level, that conundrum of how do I meet the nursing home level of care and still be able to do these activities. I know it was an education for me. Before coming to PACE, I was in the outpatient therapy world, and kind of my understanding of what a nursing home level of care meant. I learned I did not have the correct understanding of that, and meeting the nursing home level of care is a very broad, range. I mean, we have participants who drive themselves, to our, day centers, and yet they meet the nursing home, level of care for that, or can still do, activities, because those nursing home level of cares can range from, memory issues and dementia issues and, regular use of, dialysis and oxygen. So it does not, mean that somebody has to be completely homebound, can't get out of bed. And I know those were some of the stereotypes and misconceptions I had of a nursing home level of care before coming to PACE.
Absolutely. And yeah, I worked in a nursing facility prior, and yeah, part of my job was for those who wanted to leave the nursing homes was to help find resources. And I agree. I think a lot of people and a lot of families don't realize that their loved one meets the level of care. So I always say, if you need help in the home, just give the PACE program a call. We're not going to charge to assess or to talk with somebody. There's, really no negative to calling if you're looking for some help in the home to see if someone would qualify. There's a question about, can a couple qualify? Yes, we do have married couples and they're both PACE participants. Now that does get a little bit tricky because both people's income and assets have to be below the income and asset limit for Medicaid if you're applying for Medicaid. But you can also, like I said, private pay for the program. So married couples sometimes can both qualify, and we have married couples enrolled in the program.
And we had one question on, if I was looking, my wife, or it could be, anyone, enroll in PACE, what might they qualify for? And I'm assuming that might be like what services, might they qualify for? If it's how do they qualify, we kind of covered that. But as far as what services they would qualify for, when I kind of went through that, that circle of, care, it is one of those things where not every participant needs every one of those kind of check boxes or areas of services, at a time. So I wouldn't want some of the things like, well, I'm not on any, I don't take any medication, so I don't need PACE. You're not on medication now, that's great. But knowing that you have a program that you might not need to take advantage of that part of our service, or again, transportation, it might be a spouse would rather, take their spouse to their doctor's appointment or into one of our centers. That's fine. We want you to keep that independence. If you've got that, family member that can provide transportation, great. And also, if you need us to provide that transportation for your medical appointment, we can. So all of those services available within the PACE program, but you don't have to use them all or use them all out at one time. With that, oftentimes someone's needs are going to grow, and the level of care, the amount of services with us as they kind of stay in the program, that we'll need to start incorporated in some of those services or other disciplines within the program.
One of the other services I like that we have, and I have, and Rashea has participated, is that we've been escorts. And sometimes people have to go to specialty appointments, such as a neurologist or a cardiologist, and a family member is not able to take them to those appointments. And that's okay, because we have staff members that will schedule the appointment for the participant and also schedule to have them picked up by one of our drivers. And then escort will meet them for their appointment, to be there with them, to either go into the examining room with them or just sit with them in the office. And so I've done that several times, and it's really kind of rewarding because you get to know the participants on a different level. I think it's a very good service to have, and because sometimes going to appointments without your family members and then by yourself can be very daunting. And then you have questions, and you might forget to ask questions and things like that. So we make sure we try to cover and be as much